Hi everyone, I guess we're live. I'm Dr. Marcus Rosenkrantz from Reproductive Health and Wellness Center here in Laguna Hills, California. And we're going to do a little Q&A today with Carla Esparza, who is a pro UFC fighter who did an egg freezing cycle with us. We've gotten a lot of good feedback, and we decided to set this up so people would be able to ask us both questions. So I think Carla's going to join us here in just a second.
Hey, Dr. Rosenkrantz.
Where are you?
I am at Starbucks.
Are you in California or are you out of California?
I'm actually in Las Vegas right now. So I had to find a good Wi-Fi spot on the go.
Hi, thanks for joining.
Yeah, no, I'm really excited that we're getting to do this live. It's something I've been really wanting to talk to people about. When I made the post, I had like so much positive feedback and so many messages and like questions about it. So I'm glad I kind of have this opportunity to just answer questions and kind of put my story out there and kind of why I did this.
Yeah, it's been a good experience. It's been great working with you, and I think it's really amazing, courageous, and honest for you to be out there telling your story. I'm sure all of your fans will have more questions for you than for me, but we're going to see how it goes.
Yeah, for sure. Just to kind of like put it out there, this is something that I just kind of found out about a few months ago, and a friend told me about it, and we're like, this is something you really need to do with your profession. And my wife and I went through like so much, money and headache and stress trying to do this like later on in life when we were having problems conceiving. And I don't know if I'm going to have kids in a couple of years or maybe 5 years or maybe longer, but I love having this option so that, if I do have issues that, I still have an opportunity to have a family, because this is something that's been always like super important to me. I've always wanted kids. And yeah, that's kind of how I got into it and wanted to do it. After my fight in Florida, somebody told me about it, and then next fight I was on it.
Great. Yeah. And how was the experience for you?
I did some research before I did the experience, and I was like, I don't know, like really what to expect. There is some information out there, but not, I don't like know anyone personally who is doing it, and not in my situation. I don't think this is something that a lot of like younger women do, or, even athletes. Like no one I know has done something like this. So there wasn't really like a lot of, just feedback I could get or people I could talk to. So I didn't know what to expect, but it was honestly like not as bad as I thought. Like, like every day I had to, inject myself with needles, and I'm so scared of needles, but, the needles are really tiny, and each day got easier and easier. It was about like, I think like 9 days for me. Like, I know it depends on the person, but I think it was 9 days of shots, and then that was it. So it definitely wasn't as bad as I thought. Not too much like work, or there was a little bit of like hiccups of like not knowing how my body was going to react. So that's why I had to keep going into appointments like every other day or whatever. But it's a couple weeks out of your life for such a huge thing and a security, it's like so worth it for me.
After when you came to see me and then talked about your profession, after you had left, I did a web search, and it's amazing that there isn't really much literature on it. I mean, there are a few celebrities that have spoken about freezing their eggs, but nothing that I nothing that I could find about professional athletes such as yourself. So that's awesome to get your story out there.
Yeah, for sure. I mean, and it's such a private thing. Like, I could see why, a lot of people want to keep it, like it's a personal thing and it's private. But like for me, and you even asked me a few times, like, are you sure you're comfortable like putting this out there? But like somebody telling me about this is the reason that I did it because I had no clue because nobody talks about it. And I think it's something that people really should know because it's such a huge thing. And it's as a woman today, like, who wants to have her career and, as an athlete or even any other like high level career, it's hard to, kind of just throw a kid like right in the mix because it takes so much, like I'm sure all the parents know, it takes so much effort and time and energy, and maybe that's not something that makes sense for someone in the middle of, trying to climb the ladder in their career or as an athlete, so I love having this option.
Yeah, I think being a professional athlete comes with its own kind of set of interesting things about what with egg freezing, but really it relates to any professional woman, right? And their career path and being able to have potentially some options in the future that wouldn't be there. All of the burden for childbearing, is on women, and there's such a limited amount of time. And men, women, we all have these professional goals, and so yeah, I think egg freezing is an amazing opportunity for people, and something that we should be talking about more often and letting people know about.
Anastasia, you just asked me, how do you feel now? Like, did this stop you from training? Um, During this process, you're not supposed to like be training like really intensely. Like, I think you can still, like, you can walk and be like lightly active, but I definitely couldn't go like sparring, like kickboxing sparring or anything. So the whole process of like the injections and the egg retrieval takes, give or take, like I think it's 8 to 12 days. So within that time, I knew you have to take like the work, the training and stuff kind of light. So I did have to take a little bit of time off, and I think for a couple weeks after, kind of same like kind of light because of, your, I think if Dr. Rosencrantz can, you know, uh, expand on it, but I think your ovaries get like bigger or something, and you don't want any like torquing or something like that. So, but honestly, I scheduled it so that I would do it like right after my fight. So within like a couple weeks post fight, like I knew I was gonna have time off anyway, especially I had like a little injury. So it was just kind of like it worked into my schedule and it worked out perfectly.
Carla, I love listening to you give these answers because it makes me feel like I counseled you so well. Like you know the answers to those. You nailed it. That's exactly right. As you are going through an egg freezing process, we want to collect a good group of eggs in that one cycle. So we use these injections to stimulate your ovaries, and your ovaries get enlarged, and it can cause a little bit of pressure, a little bit of bloating. And while they're large, we want you to just take it easy. And it takes a little bit of time for the ovaries to recover, even after we take the eggs out. People can certainly, in a regular profession where they go to work and sit at a desk, they can go back to work the next day. But in terms of heavy exercise and activity, yes, you got it exactly right. We want you to wait a little bit of time, a week or two, as your ovaries heal from that and recover.
Yeah, for sure. And Bridget asked me, how many days were you on bed rest? That was 0 days on bed rest. So like all the injections, you can still go about your normal day, go to work, do pretty much everything you do on a normal day, unless it's like kickboxing sparring. But even the day of the egg retrieval, where they like go in and get all the eggs to freeze, I left that appointment. I went to go eat, and my dad had hip surgery that day, so I drove like 45 minutes to go visit him. Went to a movie, went to an arcade that day. So 0 days on bed rest for me. I mean, I was like slightly uncomfortable, but like I know every woman is different, but for me, it didn't like really. I wasn't really out any days at all.
It was Halloween. Did you go trick or treating?
It was Halloween, exactly. So I I don't think I wanted to do like a crazy amount of walking, but I did get dressed up in my costume as Lilu from Fifth Element, and I went to go watch the Joker movie that night. So it was kind of chill night, but still got to do a little bit of walking, got some ice cream. You know, nothing too crazy, but I definitely was still able to go about my day.
So in general, the injections that we use to stimulate the ovaries last for around 10 days. And during that time, we expect women to be able to go to work. The day we take the eggs out is usually, that's the day to stay home and recover. Obviously, Carla's a pretty tough lady and was out pretty quick. But that's really the only day off. And then by the next day, we would expect that women who have a normal work office kind of job should be able to go back. So it's not no bed rest, but maybe one day off at work.
Yeah, so not too bad. But yeah, I don't know if anybody else has any more questions about the process. Like for me, it was a lot easier than I thought it was going to be, but the shots like still kind of, not my favorite thing, but got easier each day. And I got in my routine. The first day, it took me like 25 minutes to do 2 shots, like watching the videos and figuring it out. But yeah, like after it got a lot easier. So being like older, the older you get, obviously like the less eggs you're going to have to freeze. If I had done this, when I was 25, it would have been better. I know originally I had in my overview TMI, I had like I think 15 eggs, and with the injections, like again, Dr. Rosenkrantz can like clarify or kind of explain it better than me, but I know with the injections, like not all of them wanted to like grow to a certain level where we could have taken them out. So they took out 10 eggs and we froze 8. So, it's a good number. It's not the best number in the world. As an athlete, Dr. Rosenkrantz said, we expected, and being a little older, not to be able to get as much. And I think that's why a lot of women even go through this process twice to get the amount of eggs that they're comfortable with to give them a chance at, having a child down the line.
Yeah. Too. Every woman has a different set of amount of their ovaries. Every month you have these waves of eggs that come, and the idea of the injections that we give is try to get these eggs to go. So normally, if you ovulate, one ovulates in that wave and die, and if you don't ovulate, then that wave kind of goes away and they all die, and the next wave comes, and our injections try and rescue those. And I think with athletes, sometimes the way the brain and the ovaries kind of communicate, the response isn't as robust as maybe you would normally expect. But I think that your overall cycle was really good. Yeah, I was really happy with it. And some people do it twice. It's a lot to go through, just like you're talking about. It's a lot of injections. It's a procedure, so to go through it a couple times is definitely challenging.
Yeah. Somebody asked you a question. They said, Dr. Rosenkrantz, do athletes have different circumstances?
Thanks, Carla, because my phone's too far away, so I can't see all the questions.
No, mine said, do athletes have different circumstances from Cindy?
Well, you did, right? Because you had to get clearance for all of your medications.
Yeah, for sure. So with anything that I put in my body, like with UFC and the testing body, USADA, like I am so scared of getting popped for something. So anything I do, I always have to clear it with them first. So as soon as I went to go do this process and they told me like what injections I was going to take, I went straight to USADA and I asked them and I cleared everything with them.
Right. USADA is the U.S. Anti-Doping Agency, and they didn't even ask us any questions. I think they were good with the information that you provided, right?
Yeah. So, they said everything was good to go on my end. All the hormones were totally legal for women to take. So, yeah, it was no problem.
Well, that's certainly a different set of circumstances, right? Having to get approval for the medications that you take. The other thing, and what we've addressed already, I think, is that you had to be away from training for a little bit. So you had a break, right? You had just come off a fight, and you're
Yeah.
not expecting. When is your next fight scheduled?
I don't have anything set right now, but I'm hoping to fight early this next year. Gonna get kind of back in the swing of things this next couple weeks and get back on the ball and hope to fight soon for sure and be in camp again.
Yes, kind of needed like maybe 2 to 3 weeks, and it just sort of depends. But three weeks is probably a good number for athletes that they would need to take the time to go through this and couldn't really do the rigorous training. So I think that's another unique aspect of what you do.
Yeah, I think it says just no like rigorous training, so I'm gonna go back to like technique and stuff. I just had my egg retrieval and just focus more on technique until I can kind of ease back into more strenuous activities. Somebody said, Haka Hatwan, sorry for butchering your name, they asked, is there anything you can or can't eat during the process?
We didn't really give you too many diet recommendations during your exam that I can. When you go through ovarian stimulation, sometimes your ovaries can over respond, and so we can be careful afterwards, after retrieval, about what we eat to limiting sugar intake and increasing our protein intake. There are some nutrition tips just for people in general for fertility, and about eating well and healthy. Having daily dairy is another recommendation. Watching their trans fats and fried food intake, decreasing your animal protein intake, and increasing your plant protein intake. So there are some things for people who have infertility that we talk about for nutrition. And certainly after retrieval, there would be some recommendations if your ovaries had hyper-responded. But I think otherwise we kind of let you eat what you want to eat. We assume, by the way, that you're eating a healthy diet just because of your career too.
Yeah. No, well, Eddie asked me, when do you want to have kids? That's a tough one because it kind of depends on where my career is going. With fighting, like, ideally I'd love to fight for quite a few more years, but let's say I only have 3 more years in me, I'd probably like wait till afterwards to try and have kids. But if I'm gonna fight for like 7 more years, I might have 1 kid in between and then one after, or like it's hard to say, and I don't know what's gonna happen with my love life, or that's kind of why I did this, because you can have like a boyfriend or something and things are going great, and then you guys break up and you're like, oh my God, what am I going to do now? Like, I want to have kids, and we were going to have kids in like a year or two, and now I'm like, help, like, I need to find another boyfriend really quick. Like, I didn't want to feel like I had to rush based on like the man that was in my life, or, have a kid with someone who wasn't right just because I wanted to have kids, like, I think that's what a lot of women do. They're just like, oh my God, my clock's ticking. I'm just going to try and get knocked up by the next guy that comes along. And I don't think that, a woman or anyone for that matter should settle and have kids with someone who they don't want to have in their life for the rest of their life.
Yeah, listening to that reminds me of 2 things. I remember when I first came out of my training, I sat down with a patient, a couple, and she stopped having periods altogether. Really young. She was in her early 30s, and she was basically in menopause. And I remember saying to me that this was not in her life plan. And life is tenuous, and we all have these plans, but I think life throws curveballs, and we can have these plans in our minds, but that's not necessarily what happens. And I think the idea of freezing your eggs earlier, gives you some autonomy and gives you some options potentially in the future that you wouldn't have had. And so while we all like to have our life plan for us, life doesn't work that way. And so definitely don't want to get yourself into relationships and have kids, you know, just for the sake of that. So I think that egg freezing and giving you more options and giving you giving women that power to make their reproductive decisions is really cool. We're glad to.
Yeah, for sure. Some Anastasia asked, what is the best age to freeze your eggs?
Yeah, so the younger you are, you know, the better quality your eggs are going to be, and so it's all individualized for women, depending where they are in their careers and life, and what their ovaries look like, and where they are with their eggs. But in general, you know, the younger you are, the better off you're going to be in terms of success.
For sure. So best time is now because you're not getting any younger.
TikTok.
So I think that's it on the questions that I see. I don't know, Dr. Rosenkrantz, if everyone's kind of just saying hi. Hey guys. I don't know, Dr. Rosenkrantz, if you had anything else that you wanted to add.
You know, I would say that it was an honor to be able to take care of you. I think it was a really great experience. It's our pleasure to be able to help women who are in your situation. Women's healthcare has always been so important to me. It's why I got into this field, and the idea of empowering women with their reproduction is fantastic. So I'm grateful for you. Thank you.
Yeah, thank you so much. Dr. Rosenkrantz has been like, you've been, you know, just made me feel so comfortable and have been so professional. The facility is like so nice. Doesn't really feel like hospital type, you know, like setting. It's like really like nice and like just good vibes. You know, I know you guys just recently opened too, so I was glad that I was able to like come in and, you know, I found you guys. I just shopped around like as, you know, most people do, and just seemed like the best fit for me. And I was just super stoked to have found you guys. So if anyone lives in OC, you know, or like nearby, Dr. Rosenkrantz is amazing.
Yes, thanks. That's so nice. We're at Reproductive Health and Wellness Center. We're in Laguna Hills, and you can certainly look us up online or on Instagram, reproductivehealthwellness.com. And we would love to be able to help anybody who's looking for help.
Cool.
Is that it?
I think so. Thank
Enjoy
you guys so much for tuning in.
Thanks, Carla.
Bye.